Sir, you can start.
Sure. Thank you. Is Sadia introducing?
Sadia?
Yes.
Yeah.
A very good evening to one and all. I'm very privileged and honored to introduce our prestigious speaker for today's session, Dr. Ravi Budar. He has completed his MBBS from SAIT GSB College and received his Master of Philosophy from BITS Pune in 2004. He is a board certified practitioner and has served as medical officer, assistant vice president, business integrator, CEO, and wellness director in his past years. He has also been an integral part of digital therapeutics, telemedicine services section editor. Currently, he has been elected as an executive member for the Indian Society of Lifestyle Medicine and is a full-time lifestyle physician and a medical analyst. So, on behalf of PSPP, I'm very grateful and delighted to welcome our eminent speaker, Dr. Ravi Modali, sir. Hand over to you, sir.
Thank you, Sadia. Thank you for the wonderful introduction. And friends,
You're welcome, sir.
as you're seeing in the slide, it's all about studying, playing, and learning from personal experiences and taking charge of your health and enabling others. So that's the way ahead. Of course, I have shared a few of my associations. I do work for Connect and Heal, which is a digital health platform where all the latest methods of practicing medicine through telemedicine, digital health, that is the core of the services. And of course, I lead the initiative of Indian Society of Lifestyle Medicine, and very happy to be associated with the PSPP, where all of you are members, most of you are members. And I should say it was a wonderful discussion with Dr. Karthik, who actually introduced me to this wonderful dynamic association. Happy to be with you. And friends, the key approach, which might sound different, but it is very natural to all of us. The intention is to engage ourselves in well-being more than diseases by activating self-care, right? That is one core element. By this, what we want to achieve is we want to keep health in the comfort zone and diseases in the control zone. Yeah, what more in the pandemic era, what we are going through. Pandemic is not only COVID, even the non-communicable diseases like diabetes, hypertension, heart diseases, also are the pandemic which we are living through. And let's share, what is the thing which is of good interest to farm the doctors. Let's explore in the next roughly, 45 minutes or so. So the topic for today is lifestyle medicine and chronic disease treatments. And I'm going to share towards the end, I'm going to build up how the relevance of PharmD doctors comes out, as a central piece to all this development. So share about my profile. I'm a lifestyle physician and a medical analyst at Connect and Heal. As I share, it's a digital health platform providing solutions to telemedicine primarily. More or less, it's a primary care hospital. I also have background on around insurance, advanced medical underwriting through Swiss Re Institute. So I do understand how the dynamics of insurance works and how healthcare can be aligned to the insurance concept, and also the relevance of health analytics, telemedicine, and digital health, which is the future of the way of practice. I did write two chapters for Insurance Institute of India, as Sadia shared. So, friends, whatever you're hearing from this particular background. All my learnings has happened from what I have worked earlier. Okay. So, friends, the order of today is like I have few questions around quiz just to stimulate your minds. Yeah, it's an evening today. I mean, right now it's evening. You would have had a work day. Questions will actually stimulate your thinking. And what we could do is, since we are not sitting in a classroom, I will be talking over the questions. I might be giving you around 10 to 20 seconds. You just note down your response. Immediately after the question, after 20 seconds, I will flash the answer. So it's sort of your self-check. It's not really a competition between all of us and who is answering first, not that way. But you just try to find the best answer and you'll find the right answer and your thoughts more or less will start getting aligned. Okay, so quiz to begin with, then a brief about lifestyles, reality check styles from the medical part of the risks. What then a very important understanding of health and financial economy. Globally, we are going through an economic crisis because of health, because of lack of health, lack of well-being, and we'll get a quick understanding of how to understand that piece, and then delve upon genuine opportunities what all of you have and what doctors like me will be very interested to work together. Okay, that's the order of presentation. So let's jump into quiz. That's the first quiz on your screens. Kaun banega crorepati? Who's in control of? What do you think is the best option in the five? What you see? Take 10 seconds.
One,
Don't
sir.
be. No, no, need not answer. It's going to be too much.
Option D,
Just
sir.
answer to yourself. Answer to
Option
yourself,
D, sir.
and I'll give you after 20
Option D,
seconds.
sir.
Oneself, sir.
All in one.
Sure. Okay, my request is don't speak out, okay, because it might be lot many people speaking, then it might get a little commotion. Just keep the answers to yourself. Okay, oneself. So whoever answers that is right. Okay. Next question. Please answer it to yourself and keep it with you. Community health and wellness. Right now, it is more important, right? When we say social distancing, we are talking about community health. What is the best response of the five? What you see? Is it a commercial plan? Does it depend on doctors or the resident doctors? Is it when government fails, when community has to take control, or it doesn't come only from hospitals? If you have your answer, just see. People need to own up community health and wellness and take the services of doctors, hospitals, and also the primary initiatives comes from people, owning health and wellness, demand side. Yeah. Otherwise, what has been unless until a doctor says, people will not even think about health. It doesn't work nowadays. Yeah, people have to own up health and they have to demand, I want services here. Immunity. How does immunity develop in the body? What is the best of the five responses what you see? Okay, that's the answer. Immunity by itself is in the body, and we should nurture that. Even if you are taking vaccine, unless until body has a good immune system, it will not be able to generate the antibodies. Yeah, though throughout the world they are saying, okay, vaccine will come and then we will see protection and all. Actually, it's not. First immunity, secondary is, how the responses and all will happen. Okay. Next question. Hello. No, no, wrong time. I'm in a session, maybe after 2 hours. Thank you. Okay, many options in this question. Recovering from present economic crisis. What is important? Okay, let me show the answer. Right? It's not about reactive care. If you see all the options, stress, more ICUs, is all about reactive care. We need to become proactive. We need to believe in well-being of whole self. We need to redesign the workplaces so that they are more safe from viruses. And we need to make use of the good wisdom what we have earned through ages and ages. Yeah, this is what will help us win over the economic crisis. What is health as defined by World Health Organization? What all does it include? Please make your choices. Okay, it's all of the above. All put together makes a person whole. Physical fitness, you people are the best here. I'm sure all of you will get the right answer. What do you think? Okay, the right response coming up. None of the above. Yeah, adverse drug reactions are not diagnosed easily, and they are not getting documented well and reported so that we actually can, handle them well. Learning from the past, adopting in the future, not happening well. Clinical trials don't rule out drug reactions. They only mention what all side effects are possible, and they put it in a script. Very difficult for a doctor to follow, very difficult to be implemented, and care and all around that. And adverse drug reactions, they're not happening because people are not reading that script which comes. But it's very complex to deal with. And that's essentially where the relevance of today's sessions, what I want to bring out. So, friends, if I had stimulated your thinking well, let's go ahead and understand few things as what medical sciences has proven. So let's try to see what are the reality checks around lifestyle. Lifestyles are silently rising. And there is some statistics since 1990 which shows like this. If you see the risk factors which were there in 1990, and after almost 26 years, what's the trend, right? We see all these risk factors, say malnutrition, or water-related sanitation and hygiene, wash, air pollution, dietary risks, tobacco, high blood pressure, glucose levels being high, occupational diseases, cholesterol levels, all these are acquired. Nothing is natural. Nothing is something which you have got by birth. And look at that rising proportion. Dietary risks have risen 70%. High blood pressure, 89% rise. High sugar levels, 127% rise. Tobacco, 14% rise, despite a national protocol, to quit smoking, stop tobacco use. Tobacco kills. With all those efforts, it's still rising. Water-related diseases have come down because of a good public health system, where we can believe that public health system actually works. Cholesterol levels rising up with all the fast foods. Body mass index significantly going up. As a globe, people, we are putting on weight very early and for a long time in life. Alcohol use is going up. Occupational risks, renal function, unsafe sex significantly high. Environmental risks, physical activity, low physical activity going up. Bone mineral density issues going up. Sexual abuse. So, friends, we have come to a point where environmental risks, metabolic risks, behavioral risks are actually impacting most of us. That's a reality. This is India, by the way. This is not, we're not talking of Western countries. This is core Indian data. That's a reality. Risks are rising. Friends, this is how people are living their lives if you see from the lifestyle risk approach, right? And we have a lot to do together. So let's try to understand that type of tornado effect. What we are seeing, what exactly are these? Of course, there are something good, and there are something which can be addressed. Survival and life expectancy. As each decade passes by, we are living more and more. We are living longer lives. In 2017, the life expectancy in India was 68 years. In 1950, on an average, people were living maximum 46 years, which is good. We are living longer lives. But the lifestyle disorders are also increasing. That's a poor quality of life and long life. This is what most of the people are getting exposed to. The boundaries between life, health, and disease is getting blurred. What we think we are doing, expecting something good, after some time it tends to show back, it actually harmed you. Very realized very late. Symptoms of poor health are rising in variety. What are we seeing in COVID? People might not have symptom, but suddenly emergency will come in. You rush to the hospital and say, oh, I didn't even have cough, but I got tested for COVID and I'm in an ICU. My lung is falling weak. My SpO2 has come down without symptom. In few days' time, yeah, that's the type of manifestation is what we are seeing. Body systems are not able to respond well to give an early warning, and so that we have time to respond to. Diagnosable conditions are silently rising. Hypertension, diabetes, heart related, slowly they are building up in the body and manifesting very late. Treatment cycles are long term. Medicines, if they are prescribed, more or less, most of them need to take it lifelong. And that's where the important role of pharmacy comes in, which we are going to discuss in detail later. Medicines and surgeries are insufficient to reverse diseases. They at best control the manifestation of disease, but the growth of disease within the body is yet to be addressed. It's not addressed well from the traditional medicine-based approach point of view. What about the length of quality of life? More years of life are lost to poor health. Yeah, so that's the explanation of the tornado of what I had shown earlier. Okay? Okay, one more reality. A diagnosis, a prescription, and forgetting the patient is not enough, friends. There's more to it. There is a patient who doesn't like being diagnosed, and he's suffering with poor health due to disease or due to the poor health itself. They need care. And what is the third dimension? It's a person who becomes a patient and incidentally they have a diagnosis. No one among us, even the people, they want to label yourself with a diagnosis. No one is proud to have a diabetic. In fact, they want to suppress that. That's where the issue comes in. Suppressing the information, not opening up. Yeah. And we want to give the comfort to people that, come to a safe system. We understand you as humans first, as people first. Then at some point you become a patient and quickly we want to reverse you from patient to becoming a person. And let's see what best we can do with the diagnosis. Can we reverse a non-communicable disease is a question what we need to try to answer. So a person struggles in life, a patient suffers in health, and a diagnosis is linked to a prescription. There are dynamics in all these elements which have to work together with one objective. We want to create happy, healthy humans throughout the society. And that this is always it was there. It's not that this is not something new. Everywhere, every time it was up, it was not shared with that clarity. And today, this is the demand. People will respond if we actually provide services congenially, compassionately, and with a human touch. Whole person approach to medical care is needed to be adopted wide and far. So friends, now if I introduce to you what is the definition of lifestyle medicine. Lifestyle medicine, by the way, it's one of the latest clinical disciplines which got introduced with very rigorous clinical studies. You would have heard about longevity studies, following what is happening to human health over years, over decades, and also people who have crossed 100 years of age. What are the good things they have done in life? What has taken them to over 100 years and they are happy? That's the essence of lifestyle medicine. Nothing around lifestyle medicine was touched in any other discipline. All other disciplines were either the research was around the diagnosis or the research was around medicines or diagnostic tests. Yeah, this lifestyle medicine is centered around research around human health. Okay. So it is clearly the first line of assessment and the treatment for all lifestyle diseases. It's the first line of treatment too. It was always spelled. Yeah, only the clarity of how exactly this discipline should work is what we'll understand the little details. Okay, So lifestyle medicine is a clinical application of medical, behavioral, motivational, and environmental principles to the management of lifestyle related problems which are rising in incidence, right? Prevalence in a clinical setting. Lifestyle medicine is practiced in a clinical setting. Teaching self care and self management are important elements of lifestyle medicine to overcome the reactive ways of living. Yeah, we want to overcome reactive ways of living by adopting healthy personal practices, healthy personal behaviors, and healthy personal habits. This is what Dr. Gary Egger has defined lifestyle medicine, which is adopted in the in the practice, and training is being conducted around this approach. And what are the objectives which align lifestyle medicine with health? In India itself, we have declared accelerating towards health for all in Ayushman Bharat, where clearly the presence of well-being is more important than just absence of disease or treating diseases. Yeah. So enabling people to achieve the best of the health states will actually protect them from preventable diseases. And this is in Ayushman Bharat, our own in India. And by this, we have committed to the world that we will reduce the prevalence of diabetes, we will reduce the prevalence of hypertension, we will reduce the deaths happening due to non communicable diseases, is what we have signed in the Sustainable Developmental Goals from the United Nations and the WHO. India is a signatory to that. And accelerating towards health for all essentially is the Indian way of looking at that reversal of diseases. And believe me again, you guys are very important. You play a very important role in making this happen. We'll discuss that in brief. Healthy lifespan increases productive life years. If you are healthy, you can work better. If you work better, you will earn better. And if you earn better, the country grows. That's the logic. So health economy only can revive financial economy, especially when we are looking at coming out of COVID crisis too. Our energy, our vitality, our rigorousness to do some challenging activities, creativity, innovation, all these things requires the best of the best health in people to make it happen. Occupational health for all. This is what WHO says for work-related health. Occupational health for all and possibly in all. Yeah, it's not for. It has to happen within everybody, in all. Then we will see the goodness, India growing as an economy. And sustainable developmental goals. So these are the areas where already the relevance of lifestyle medicine has been spelled out. We only have to materialize them. To share it in a different sense, we all know heart diseases is the topmost killer. It comes anytime anybody and everybody has the fear of, my heart could be at risk. And that has a link with obesity, putting on weight, as well as metabolic health, all our diabetes, hypertension. All these are related. It's only for some it manifests in some way, for some it manifests in another way. Again, here the lifestyle assessment is the first line, and treatment through lifestyle methods is the first line of treatment as per all the protocols known. And you see what is shared in the levels of care. The first is unhealthy lifestyle practices. After that comes primordial prevention as a level of care. Then comes primary prevention and secondary prevention. And in all the levels, the relevance of lifestyle modification and pharmacotherapies appropriately are connected in every level. And that's where the importance of this session as a doctor, as a lifestyle physician, sharing it to members of PSPP, right? And let's look at what are these things. This is something which American Heart Association has built on. So we are talking of a clear study, a studied approach is what we are trying to get acquainted to. So here it is. What is unhealthy lifestyle practices? Poor dietary habits, physical inactivity, cigarette smoking, alcohol, excess screens, indoor living, sedentariness, varieties of them, so many of them, gadget use, all these elements which voluntarily people are taking. It's not happening automatically. Intentionally, people are making these choices which are going against people's health. That is the first level of care. What needs to be addressed. Second level, aging. After a particular age, health risk increases. If there is a family history, hereditary disease conditions, people can become proactive. Things like dyslipidemia, diabetes, obesity, hypertension running in families. If you know a family background is around this, you can take very early steps to improve lifestyles and still you can postpone diseases out of your life. That's the second level of care. Psychological stressors, typically in the urban life way of living. We take stress and then the stress affects us. This is the second level of care, a primordial prevention. Then comes where we are able to make some diagnosis through preventive health checkups. The subclinical case diseases, these are not evident, these are not waiting for symptoms. This is a silent level where so much of organ dysfunctions actually manifest over a long period of time. These things are getting detected at a preventive health check level, which popularity has to be increased. Then comes the first event, either a heart attack or heart failure, peripheral arterial diseases, giddiness, fainting attack, sudden death. These are the type of symptoms, where people have to rush to ICUs, rush to hospitals. Why did it happen to me? I was always healthy all this long. All these important things were ignored when all these things were existing and known. And then the second event, where it could be an irreversible condition, some organ damage, tissue damage, ectomies needs to be done. An organ has to be removed and out of the body to actually save from a symptom. That is a type of a continuum. So friends, I believe that this slides, I think most of you got acquainted with the spectrum of care which was not addressed well and needs to take a very strong position to meet all the goals, health-related goals at an individual level, family level, at a country level. Okay? This is a very important slide to get a foundation of how as a professionals, each one of you can put yourself the right step forward. Now, what are the elements? Now, since we all understand pharmacology, there are a few elements I wanted to bring in here. Lifestyle medicine behaves the same way as medicines. There is a dose-response relationship. The right dose and looking for the right response and then continue with that practice over a period of time to actually realize benefits. And then there are compounding benefits. You do physical activity as well as you improve your dietary habits, as well as you stop smoking. If you do all three of them, then the effects are significantly high beyond just the summation of them. Compounding benefits. Then we target what are the treatment endpoints. We are going to discuss brief about this in the next slides. Treatment endpoints. How we can see a disease prognosis. People should live longer even with a diagnosis. The effect of diseases should be reduced. If possible, reverse a disease. Yeah, reversal of diseases is something what we'll hear more and more now onwards. Every doctor should be able to adopt that practice. Every doctor in the hospital, every doctor in the clinic, every PharmD person, every paramedical staff should be able to understand how is it possible to reverse a disease. If health has to progress, then finally, people have to live a long life, a healthy life. And the list is never ending, but I'm just flashing few of them. In healthy eating, there is something around fibers, nutrient, calorie to be reduced, objective of promoting health, a disease-specific healthy eating practices. For physical activities, you can use physical activities to improve health, to reduce disease. Relationships is a very important recommendation and an advice from the lifestyle point of view. Talking to people, learning emotions, learning positive emotions, learning how to come out of negative reactions is all around lifestyle. Culture of well-being, adopting healthy cultures, learning from healthy cultures, reducing isolation, connecting with people. We say See, there is a huge difference between social distancing, what I was told. Actually, what is needed is physical distancing and social connectedness. That's why telemedicine was launched as under medical guidelines. So, friends, today onwards, you'll not use the term social distancing, which means don't talk to people. We'll be talking about physical distancing to keep you away from the disease risk of COVID, but social connectedness. Sleep, sleep, varieties of recommendations around sleep. Non-nutrients which people are consuming. Smoking is a non-nutrient, tobacco is a non-nutrient. It's a psychoactive drug, right? It's a bioactive drug. Alcohol, excess sitting, social media, we are consuming data. Before we even realize and do it consciously, we are consuming data and data. And the mind is getting lost with so much of data. Gadgets, radiation, painkillers, antibiotics, managing stress, anxiety, depression, obesity, toxic way of living, blunting immunity. What happens with stress is the small cells or the receptor of the cells lose their sensitivity. And that's how, the body doesn't recognize few things. Poor health outcomes. The points which are getting circled is right now, today it is relevant for us to come out of COVID pandemic. It is very important to fight the disease together as a society. Social connectedness, immune signaling efficiency. If we take vaccine, will our body be able to generate antibodies and keep those antibodies for a long time is a feature of the body, not of the vaccine. Vaccine is giving the stimulation. How our bodies can actually use that stimulation to build more antibodies is within us, right? But still, that reflect tendency is, that vaccine gave antibodies only for 3 months. Stronger vaccines. That's not the way ahead. Okay? Smoking cessations, reduce risk, reduce excess sitting. Social media, appropriate use. And friends, when I say antibiotics, painkillers, I'm saying people are using these elements without a medical prescription and not completing the course. Where serious issues are happening. Yeah, one of the adverse responses because of inappropriate use. So friends, that's just the limited spectrum what is possible from the lifestyle medicine. Of course, that is huge. We can have maybe 100 such slides of saying the varieties of interventions is what we can have. But these are the most important, most common, which will bring the best results if these are used in the dose-response relationship for adequate time to see the impact on the positive impact on health and break the disease formation patterns. These are all the personal experience time, PET. Yeah, people live these experiences day in, day out. How the experiences can be enabled towards better health and towards breaking diseases. That's the intention of lifestyle medicine. Now, to impress upon all of you on the dose-response relationships, so this is one example of the chances of acute myocardial infarction shown on the y-axis, which says 200 times risk for acute myocardial infarction or 10 times risk of myocardial infarction. Okay, that's the y-axis. What is the x-axis? X-axis is showing what is the frequency of habitual, vigorous physical activity. Something like playing badminton, playing something like hockey, running, or maybe basketball, maybe in semi-rural areas, it's around kho, playing, outside games where you tire out. All those comes under this vigorous physical activity. How frequently is the x-axis? 5 plus means 5 days in a week, and 0 means not even 1 day in a week, and that is a comparison. Now we see a sedentary subject and an active subject. If a sedentary subject, which means a person who is not used to physical activity at all, suddenly, if he tries to play such game, bowling cricket or playing cricket vigorously, the risk of heart attack is high. When a body is not used to physical activity over a long time, sedentary subject. compared to, and also you see this residual risk is high, this dotted line at 1, compared to somebody who's regularly exercising, regularly playing a game, and then he's playing intensely. There are so many good things happening because of regular physical activity that the risk of heart attack is significantly low. And the residual risk, yeah, which means at rest, my health is much better if I'm physically, if I'm regularly, I'm involving myself in physical activity versus regularly I'm sitting for a long time. My residual risk is rising up. So there is a risk of residual risk, and there is a risk of if you are getting into some activity. Both these risks actually keep increasing. That's where sometimes lifestyle medicine becomes a confusing element of, you're telling me to be active, but if I be active, I feel breathlessness. Then why are you recommending? As if though the recommendation is wrong. It's essentially how to understand the residual risk, which keeps rising with age if your wrong lifestyles are there. And activity, when activity is done, how protected you are. That's a perspective around dose response relationship, which is same as medicines. And as the farm D, I think the dose response is a very important skill set. What you have. Absorbing these elements will bring you the goodness out of you. Friends, around economic crisis, what have we seen? Before the disease hit our country, the lockdown came in. And this is where it is. When the new cases was growing in other countries, India took a decision, let's shut down, and we don't want even the first set of contractions to come. But then we did have, I think this was a successful move. But what did it do? It brought down our economy. Our earning ability came down. And said, at least save our lives, and and let's try to live together, as people. Let's try to understand each other and not work. 1 year is what we have spent, almost all the countries. But it did help in reducing the number of cases, the blue line. But then what did it do to the economy? Gross domestic product, the money what we earn as a country, it came down much higher than just the containment. Yes, we see this dip which has come. And now we are trying to create a policy, economic policies done by many that will help us open up the society. We start earning without the risk of COVID or with the reduced risk of COVID. Friends, this is a very important aspect when we are talking about economic crisis, revival, and health is a very important. The well-being side of health is very important. It's not that ICUs is going to increase the cost, but protect health. So few people actually will need hospital-based care, then the economy is going to go up. Okay, with so much of background of having lifestyle, non-communicable diseases, dose response relationships, let's look at what prospects look like. I'm just doing a quick time check. Oh, it's around 7. So maybe 10 minutes more. Friends, it's like this. The zone of disease control and remission and reversal. I'm talking about control of disease, which most of us know. I'm talking about remission, how disease can be kept silent for a long time and health and well-being can go up, and the reversal of diseases based on symptoms, signs, laboratory markers, and dependence on medication. Okay? So, what's happening in control of diseases? Signs and symptoms of diseases, whether a diabetic is having a symptom or no, diabetes has to be controlled. Still, there is so many people are taking the understanding if the symptom is not there, I'm not having a disease. That message needs to enter the society. Yeah, we need to be the protagonists. We need to be actively talking about this as medical professionals, as paramedical staff, as Farm D professionals. This talk is important. In controlling the disease, what is about laboratory markers? It is enough if you want to control that, some improvement in laboratory markers is there, then it is okay. Like, HbA1c for diabetes. It came to normal, and then after 6 months, it went up again. It's, let's bring back again to normal. So there is a, type of a hide and seek. Or sometimes it is normal, sometimes going up, just normal, abnormal, normal, abnormal. It seems to be working, it's accepted that, that's enough type of a thing. Dependence on medicines. Control of disease traditionally has been a medicine-based approach, though right now a lot of lifestyle interventions are coming up and therapeutic procedures. Maybe some ectomies needs to be done because an organ is spreading the infection or it's not able to control the disease. So this has been the traditional way. Now let's look at remission and how the same elements matter. When we are talking of remission, we are talking about symptom once it has come. We are tracking since the last have gone, how many days you're free of disease and the symptom did not surface up. Somebody who got a heart attack. We can take all the precautions, even when the person is at home, person is working. How can we ensure that heart attack will never come again? Right? That's an important aspect when we say remission. Diabetic. Okay, we found in the lab tests and can we take a point that can we track for how long your HbA1c is within normal range and not going up beyond the normal range? Can we do? We have that programs. Can we do that such type of a treatment where you don't depend on symptom, but we keep the laboratory values in the normal range almost forever? Okay, and then dependence on medicine. Now, what happens if medicines are being taken regularly, lab tests are normal, signs and symptoms are not there? What do you think is going to happen? The medicine's dependency slowly it can come down. Body is able to take care of itself. Possible. What we are seeing today, after 2 years, people are taking more medicines. Then again, multiple medicines, higher doses. All that thing can be reversed. That is an approach in the remission. That's all what I want, remission. Now, friends, let's look at reversal. What is disease reversal like? Which means we are taking health to a level which can take care of the disease by itself within the body. Possible. Let's look at how the objective parameters should show. We are talking about symptoms should not come again. The signs should not come again. Last symptom faced or last adverse health event faced 2 years back, 5 years back, 10 years back, health, improving. Lab tests, all known markers of the disease, like if it is diabetes, HbA1c, insulin levels, random sugar levels, serum creatinine, fat percentage in the body, lipid profile, triglyceride levels, all in the normal range over a long period of time. Right? That is an indicator of reversal, moving towards reversal. Friends, I don't know, somebody might take it differently, but the point is less dependence on medicine and laboratory markers being on the normal range is the actual thing. Ethically, if you see, that is the state when using appropriately medicines at the right time. But when you reverse the disease, then reducing the dependence on medicine is also a very important element if you are thinking of humans being healthy over a long period of time. Yeah, because see, we all understand medicines, good number of medicines work against our biological processes to control the diseases. Like most of the diabetic medicines, they either stimulate more release of insulin. They are tiring the insulin secreting cells, right? And I'm not sure, what is happening. If you see the way mechanism of action, they say we're interrupting a biological process to prevent manifesting an organ damage, right? And we are looking at new medicines which are coming, which work with the health processes, metabolism stimulating mechanism. What is metformin doing? Metformin is enabling a cell to use sugar more, which is enabling a health process. Right? So something like that. So that's the type of reforms is what we are looking forward to, and thinkers are needed to make that happen. So friends, I wanted to appreciate upon you control of disease, remission of disease, and reversal of disease. If we understand these, then we are aligning ourselves to achieve the sustainable developmental goals of reducing premature deaths, reducing the prevalence of chronic disease conditions, and a healthy economy is what we want to look forward. There is a list of adverse drug reactions. I need not to go through the details, but just quickly, to make our minds fresh. Cardiac disorders. With so many medicines, we see tachycardia, palpitations, bradycardia as side effects. Vertigo has side effects. Eye disorders as side effects. Gastrointestinal disorders, huge number of medicines bring this diarrhea, vomiting, flatulence, and nothing really is being done. At best, what is being done? Stop the medicines and switch to another medicines. Things like that are happening. The understanding of pharmacy, the practice of pharmacy is somewhere it's getting a miss, and this is an opportunity where this expertise, what you have gained, you can bring that in practice and actually enable the healthcare system. Yeah, hepatobiliary disorders, immune system, hypersensitivity reactions, metabolic issues, loss of appetite, respiratory. All these are a list of adverse drug reactions noted in India for each of the systems of the organ. Yeah. Um, okay. Now another list which is showing the commonest adverse reactions, erythema, which are the list of medicines, pharmaceutical, which is featuring in erythema as a side effect, antibacterials, antithrombotics, detoxifying agents, cough formulas, blood thinners, blood substitutions, contrast media, additives. Hypotension is a side effect of huge amount of antihypertensives. Yeah, pruritus, itching, antibacterials, cough syrups, all are causing. It's a huge list of adverse drug reactions and the families of medicines. So, friends, this is the spectrum. This is the reality what we're living. I think the few of the Western countries, they talk about adverse drug reactions are reducing life of good number of people. It is one of the top 10 killers, adverse drug reactions. Unintentional, no one intended, it's happening, and very easy to blame. A doctor has prescribed this, and this is what has happened. Put the blame on the doctor. Friends, we are trying to do our best ethically, but still things are going out of our control. It needs collaborative practices. And you have a huge role to play as family doctors in getting the right side of medicine's use at the appropriate time. And when it is not needed, when the health has come up, how to adjust the doses. Yeah, that's a very important aspect which is not done very well as of now. So to put in a nutshell, I think this slide I think it's the last slide. And I want to bring all the understandings, I want to consolidate that each one of you can actually ideate your way forward as a PharmD professional. Yeah? So this graph is talking about benefits, upper side, risks on the lower side, we don't want to get there, and over a period of time, over months and years. And who all are involved in provisioning the benefits? The patient as a need, as a is coming in that, I need this. There's a payer and an insurance who's looking at quality, who's looking at health outcomes and wants to pay, wants to know, what is the good things which are happening for what I'm paying for the patient. Doctor is involved who generates the prescription, nurse who administers the prescription, a PharmD who practices pharmacy, a pharmacist who supplies, who issues the medicine under the prescription. And pharma companies, they are actually doing the hard work of discovering, identifying new formulas which are safer, works better, high potency, less side effects. Friends, that's the environment. All these players are together, essentially enable the possibilities in healthcare. And what are we targeting? We want to reduce stress in life. You give a prescription of diabetes, first 3 months, 6 months are good, but then the person is asking, yeah, lifelong medicine, is it? No, you're adding a stress to me, my energy levels are coming down, you're increasing the medicine's dose, and now you're telling injectable, because of the disease and the treatment, my stress is rising in life. We want to respond to this. Life stressors, we want to bring it down. Treatment endpoint, we want to look at milestones of the treatment. As I said, reversal is a very good milestone to target. Before that, remission. Before that, disease control. Before that, disease prevention. Right? Or before that, lifestyle disorders. getting corrected. Yeah. And we want to reduce the incidence of adverse health event. Any adverse health event happens, a patient thinks, you know what, I think I was not cared for well. After treatment also, I'm feeling adverse health events, and suddenly the trust gap comes in. Disease prognosis, we want people to live longer. By the way, when we try to prevent diseases, it's not that the business of hospitals or the business of pharmacies will come down. What will happen is people will live longer. The incidence of disease will come at a later age. Imagine right now what is happening. People at 30 years of age, 40 years of age, they're getting diagnosed. When they want to earn more, when they get diagnosed and their ability comes down, they retire early and they live poor quality of life for a long time. That with these initiatives we want to change to, you live a very healthy life till 70 years of age, till 80 years of age. If at all diseases come, let it come when you have earned rich. Yeah, that is the time it might be tough. Maybe some technology we need to work on later on. But right now, let's postpone diseases. Diseases will come at a later date. Then the same hospital treatment, same pharmacology, everything becomes relevant at that age. Happy scenario that, the diagnosis will come at a later age, not at 20 years of age, 30 years of age, what is happening now. And, we need to show up as professionals that we can offer to the society a better solution. Life longevity, health progression, there it comes. What are the areas, the operational areas where the focus needs to be coming in? A lot of innovation needs to be brought in. Safe prescription practices, especially when telemedicine practices are on, when the patient is not in front of you, PharmD and pharmacists need to do a very important work of how to enable doctors where they can safely prescribe and all the side effects what are expected can be taken care of. I'm talking of something like a telepharmacy or a PharmD actually orients the patients about how the patient should understand the prescription for the medicine what they have got. You can have the brilliant understanding of what the pharmacy company has done and how the practice of pharmacy delivered after the prescription. Protect the doctor's practice, prove your practice, and enable health, reduce the incidence of side effects because of drugs. Safe prescription practices, prescription management. 3 months prescription will be there. After 1 week, whether the patient is taking the medicines or some side effect made the patient to stop using the medicine, encouraging him, bringing it back through digital medium, through physical meetings, varieties of them, prescription administration and medicine supplies. Medicines administration by a nurse. When you're giving in, you're checking, oh, how was yesterday? Did you have any headache or something? This is the dose. Oh, you had headache yesterday. Let's check your blood pressure. Let's try to change the medicine. That's the type of, rigorous medical administration, what is possible. Medical bills reconciliation and claims when insurer has to pay, or a corporate also when OP bills they are seeing, they want to see, I'm seeing for 1 year you're taking the medicine and today you're saying you have to get admitted for diabetes. Did this medicine actually work for you? This is a discussion happening in non-medical people when they're seeing medical bills and, a word of mouth discussion about how the health system is helping them or not helping them. So all these things, what we see is, how does this benefits and risk behave? Now, this is one example of, like, you think of one medicine and what all are possibilities. There are benefits, there are risks also. Every patient, are they enjoying the benefit and not facing the risk is a very important thought required. Some benefits come late. Some risks come late. That's a different pattern of seeing. You know what? So as I've shown, the quick realize of benefits, quick risk, and persists over a time. Benefits are seen late after consuming the medicine for 2 weeks, 3 weeks. Only then the benefit is realized. We know that pattern, but patients doesn't know, right? It's for some time the benefits are there and later the benefits come down. Sometimes the risks are there and suddenly the risks vanish. All these are the permutation combinations, how the side effects can manifest for almost every medicine. Now, this is a very important spectrum. Otherwise, the patient is confused and doctor cannot handle this. Let doctor be busy in managing the disease. A good role of a PharmD is possible to manage these type of dynamics for whatever the 1,20,000 medicines whichever are there or new medicines which are coming up. That is an area of practice which is very relevant. Friends, this is something what you need to manage. Otherwise, there is a structure, but it can be easily chaotic if not understood well. So, what are we looking forward to? We want to reduce the incidence of adverse drug reactions. And there is a combination of a lifestyle medicine. If it is working at a good dose, then the dependence on medicines actually comes down. And we don't want people to face side effect and then present, and that the positive side of both. Polypharmacy. People are taking multiple medicines. How can we reduce the number of medicines and improve health and improve the response to diseases? Yeah, anything more than four medicines means some possibilities there how you can bring that load down, dependence on medicines down. Self-medication is happening. The good way of self-medication is people having first aid kit and knowing when to use the medicine for which symptom and how much dose for how long. So that practice is not happening. So if we enable this, then people will not get into a reactive practice of if there is a symptom, run to a pharmacy, take some medicine, and forget about it. It's out of the system is what happening. Long-term prescriptions is rising in prevalence, and clearly there's a huge scope of how, in a structured way, we engage people in health and disease control, disease remission, and disease reversal. And if it is lifelong medications, medicines reconciliation, dose adjustments off and on. New medicines are getting introduced. I'm not seeing many patients actually getting the benefit of the new medicines replacing the old medicines coming out of that. So all these areas are huge opportunities, what I see as a doctor. And I was just wanted to bring this across to all of us. So friends, I think I come to the end of our presentations. It's 7:28, and I open up for discussions, questions, comments, critics. Anything is fine.
So hello sir, I'm Karthik. Uh, Hello, sir.
Hey Karthik.
Yeah, I
Nice to
just
see you.
joined 6:35. So thank you so much, sir, for taking out your time and looking at the quality of slides. I can assume like how much time you have spent into making those slides and conveying it properly. Thank you so much, sir. So in session we have close to 175 students from at least 175 different
Wonderful.
colleges of family, sir. So and so if anybody has any question, you can ask, sir. Or if you want to give a feedback on how you felt, you can
Absolutely.
feel free to share. So Pratichi, maybe you can unmute and convey the same instead of putting it in chat box.
Hello.
Yeah, Pratik.
Yes, we can hear you.
Yeah. Good evening, sir. This is Pratik speaking.
Yes,
So
Pradeep.
first of all, it was an amazing session because just of an idea to reverse a disease is fantastic. Because up till now, before chronic diseases were considered to be non-reversible in most of the cases, but through lifestyle medicine and individualized medicine, now it's becoming possible to be reversed. But sir, my doubt is it everything is it in our individual hands, or also it depends on factors like food we eat or pesticides being put into food? And because recently there was a report in India, before it was not possible to detect some adulteration in honey. So 23 brands of honey were sent to German lab through Indian government lab. So almost out of 22, 23, 22 were found adulterated with corn syrup and rice syrup. So in this scenario, how much an individual can act and what would be a plan to curb adulteration or improve quality of food in India, where population is high and it's really difficult to feed these many stomachs without using pesticides. So,
Absolutely. Wonderful point, Pratik, and thanks for the appreciation. So I think I will respond as a doctor. Ideally, this question is somebody sitting in a ministry who actually governs, the food industry, agriculture, who is an ideal position to respond. And I'm sure there are some steps being taken. But as a doctor, what I would respond is, gradually we are moving, as literacy in the society, people becoming more and more intelligent. our demand is actually improving, right? And if in a society when demand rises, the producers automatically will correct themselves. Even they will improve the level of quality of the produce and all. What you're asking is an environmental intervention. It's difficult, but there are mechanisms already in place. Like if you see the FSSAI standards which have come in, which gives controls to the consumer. Consumer can represent. Only thing is some awareness needs to be created where consumer can reach out to the bodies, talk about this, and whatever relevant audit mechanisms, standard controls, all can. It's there in India. Point is, anything new when it comes to it takes a long time to actually get into the society and get into the industry. And that's where we need thinkers, we need people who believe need to voice. Like what I say it multiple number of times without tiring in multiple places. So if we bring our passion, change is bound to happen. And I believe for an environmental change, it needs a critical mass of people to believe and actually initiate from their own way and continue doing that when others will catch up.
Yeah, thank you very much for your views on it, sir. And I also hope, we all hope that it happens sooner or later.
Absolutely. You have to make it happen,
Thanks.
Pratik. It will not happen after.
Yeah, sure, sir.
Yes.
Hello, sir. Good evening. This is Dinesh, Arjun, family fifth year, sir. Actually, thank you, sir. Thank you so much for giving an insightful session. The main point I like from your session is always use metabolic stimulating medications, which work concurrently with lifestyle. So that is very enlightening point for me. And my little doubt is we usually hear in our community, sir, some people are very fit or very maintain healthy lifestyle, but still they are getting heart problems or they're getting cancer, like mainly film actors, who will do rigorous physical activity every day, who will take very precise diet, still they're dying because of heart attacks and some cancers. Uh, how can we know that? No, sir. I mean, how can we correlate that with lifestyle, sir?
Absolutely. A fantastic point again, Dinesh. Yeah, I mean, on one side, you will feel the rich people have access to the best of the best treatments. Why they are dying early? Perfect question. So the point is like this. See, health, when we say health, the well-being side of health, multiple factors need to work together to actually keep health. Versus in a disease approach, we are talking about two, three known factors, manage them, and possibly you're getting out of disease. Yeah, but health is needed every time, every day, throughout life. Now, what is happening there is, now when we say healthy lifestyle, today our belief is healthy lifestyle is just about eating healthy and physically active, and that's what popular among many people, and everything else is fine. Point is, diet, physical activity are only two elements of the unknown and growing list of lifestyles. To give an example, since I'm a board certified lifestyle physician, I'll give an example. Leisure time. Are you able to spend 2 hours of leisure time when you are very close to nature and your entire body, your entire mind, your soul is connected to the nature and you spend 2 hours quality time with nature? If that is a prescription from my side, how many people are actually experiencing that? Otherwise, we know
Yes, sir,
nature
exactly.
is the greatest healer, right? So I prescribe leisure
Yes, sir.
time, Dinesh. I prescribe talk to 5 people in a day. And people say, you know what, I only have 2 friends. And the entire world is my enemy. They are my critics. So my point is somewhere I'm talking of the multitude of factors, what makes health possible. And to live rich means they are living a rigorous life, Dinesh. Life there is not as what we see. It's not glamorous all the way. There's so much of dynamics happening, so much of sensitivities. Very hard to say. Rich people can't come like us in the society and have bhel puri as free as what we do. There are different set of issues what they face, and we need to appreciate that. And yeah, I mean, we need to believe in ourselves. Can I'm not relating my health to others. I relate to my health myself. And that's the beginning of lot many good things to happen. I hope I responded to your question, Dinesh.
Yes, sir. Yes, sir. Thank you, sir.
Good evening, sir. This is Vaishnavi. First
Yes,
of all,
Vaishnavi.
uh, I'm so glad to be a part of your session, sir. And the prescription you gave is very, very, very helpful, I think. And I take it personally, your prescriptions.
Perfect. You make my day.
Sure, sir. So I have a small doubt. I think this is not a very big deal, but still, you have kept a sentence in your slides telling that 2017, the life expectancy or people lived for 868 years, whereas in 1950, only 46 years. They'll be telling like we used to live for 90 years and 95 years. The grandmas and grandpas used to live for 90 and 95 years. So now we only life expectancy is 60 years. But the statement here is like somewhat controversial. Can you please explain that in terms of?
Oh, okay. Okay. So what I have mentioned in that statistic which got published in a few of the studies is the average life expectancy. An average Indian, what is the life years what they are spending? Of course, your point is true. We have so many Indians who are living over 100 years of age. Only thing is, it has not been maintained as a statistic. Yeah, and here the parameter is only different. We are saying, average life expectancy. The parameter what you're bringing is how many Indians are living beyond 100 years of age, and I'm sure they would be in crores and definitely not in lakhs. I can think of few states like who have the healthiest. I think Kerala is one. I believe in northern, the healthy climates, Himachal Pradesh, Arunachal Pradesh, yeah, the way where we have people who have lived. It's the parameter. I have chosen a parameter which is more popularly discussed as average life expectancy. So nothing really about the dispute what we're having in the mind. That's a different metric, and we want to work towards that. Can more Indians live beyond 100 years of age? Can we look at their lives and get inspired?
Yes, sir. Thank you so much, sir. Thank you.
Sir, actually,
Good
last
evening,
time when
sir.
I spoke,
Sorry,
you
sir.
were talking about the compounding pharmacy aspect. So I found it really, really interesting. So can you
Sure.
just throw it light on the compounding pharmacy and the formulations you give for that pharmacist to create?
Sure. Absolutely. Ideally, we should be having a separate session on compounding pharmacy to understand all the right aspects and not understand the wrong aspects. But briefly saying, it's about personalizing medications for an individual. Now, when we understand there is a dose, there is the amount of medicines which we titer based on the weight. And we have taken something like 50 mg, 100 mg, and 150 mg. My experience says if a person needs 68 mg, we should be having a way to create 68 mg dose and provide to the person, especially if it is a lifelong medication, right? So some example like a thyroxine hormone, we are having in denominations of 25, 50, 100, 150, 200, things like that. But if somebody needs 78 point, 82.5, then are we saying that you break the tablets yourselves and one day I will have 90, another day I will have 60, and some other day 120, 12, and that's okay? For me, it's not okay. And then I have few early adopters, so pharmacists who said, no, I will make it happen to you, sir. Let me do that. And what began there, we went on to say about how in dyslipidemias, how the titering of statins, how multiple, like metformin, we have gone to a level of change the form only. I hear many of my patients say, I take metformin, you told me it's good, it's a healthy and all, but I feel acidity. And because of the acidity, I don't know whether it actually is working. The obvious, I want to respond. The controlling diabetes doesn't mean that your stomach should suffer. Then went on and we found out metformin can be used in the form of a cream. Some small study, research and all, it talks about I can use on the skin and not trouble my stomach. reduce the gastrointestinal side effects, improve the response, and people are happy to use metformin like a cream. So point is, if we start thinking human, see patients as a human, the simple ideas will take form, and we will discover varieties of ways how we can compound a combination of medicines or a different form of medicines and make it user friendly. And hence the varieties of opportunities which will open up. But again, I would say we should have a separate session, a detailed session of how to the approach of compounding pharmacy and not get into a very reactive stance of tomorrow I can do something for somebody. It needs collaboration, a doctor, pharmacist, a patient, and then an approach, and then adopt it.
Thank you so much, sir. Like, if we will definitely try to get your time and see if we can do many more sessions with you. So, and how
Absolutely,
much
very
time do you
happy.
have, sir? How much more time do you have?
Yeah. So I think I have 10 minutes more for any questions, if at all. Let's take a call after 10 minutes, we'll close. Otherwise, I'm available for anyone one-on-one or a separate session. Only thing is I have a commitment at 8 o'clock.
Sure. Yeah,
So
sir,
happy to
I
take
have one more
questions and
question,
comments
sir.
till that
Sorry,
time.
I'm not letting students ask. So I was extremely impressed with the other concept of the wellness wheel. So if you can just throw a little light on wellness wheel. And the other question, and my last question is, so how can we incorporate the culture of lifestyle medicine into our own life and also our families? So can you just help us, coach us, or give us
Absolutely. Yeah,
references if we can know more, sir? Yeah.
true. So wellness wheel, what does it say is, I think earlier I talked about health happens if multiple things work together. Food, activity, stress, the risky substances consumed in a lasting sleep, all put together. Which means if you see each element as one spoke of the wheel, like sleep is one, food is another, smoking is another, alcohol, relationships, like that. If you see, it takes a form of a wheel. And it's very easy to imagine if all the spokes are equally strong and then the wheel is moving, that is the time the vehicle can move faster, comfortably, at larger speed also. The vehicle will run smooth. Our human system works exactly like that. So the wheel is an analogy just to say that health is made of multiple factors, many unknown factors also. But then the known factors, if you try to balance out, everything is optimal, health will stay at its best for a long concept of the wellness wheel. And the other part of the question, Karthik, when you said family and personal health, I think given the medical guidelines today, in telemedicine practice guidelines, there is a huge area of self-care where people need to be trained about how health is working for them, how disease is happening for them, and a good way of living, they need to persist over a long period of time. Now, a very simple example. If my grandfather had diabetes and my parents had diabetes at their age, this age onwards, we can take enough steps of not having diabetes throughout life. And it doesn't need any genetic intervention, anything. Simple lifestyles, methodically adopted as a habit, so something like that. So if the family adopts together, there's a huge family strength. Parents encouraging children get the latest knowledge, the latest methods of using gadgets, and train the grandparents how to use devices for self-care. Telemedicine services are there, telepharmacy services will be there, telepharma D practices will be there. How grandparents can learn from children and adopt technology for their needs and improve their health. So in a family, what happens? People now, grandparents have so much of wisdom to understand life. Like I think earlier also with Vaishnavi I was talking, elder people who live over 100 years, it's a wisdom. As a doctor, I will also learn from them. So we gain wisdom from the elders. Children will learn from grandparents. The middle age group, they are actively working. When they come back home, they feel happy. Each evening they come back happy, and morning everyone wakes up fresh. So lifestyle actually brings a family together much better than what we are seeing in COVID. You restrict going outside, people have come together. You adopt healthy lifestyles, you adopt family leisure time. Imagine the level of brilliance what everyone tends to gain by just living healthy life of family well-being, personal health, owning health within, and not see that for everything I depend on others. That's the huge opportunity what we should be working on.
Thank you so much, sir. Like, it feels really great listening to your talk and also the way you answer all our questions. We can take, or if not, a feedback. And I can tell all of you that sir is really concerned about family program, that we are underutilized, and we'll be happy to work with you and see to change the fortunes of family, sir, where they can be their skills can be put into practice and improve the health of our nation. So, one last question or any feedback, if anybody wishes to give, you can do now.
I think before anyone else, I would request all of you to please enter my LinkedIn profile. You can share your comments there. Let others also know because
So
this
on YouTube, we already
wisdom,
have
what is coming,
43.
it can expand. And
In
in my
YouTube, we
Facebook
already have close
also.
to 50 comments, sir. Like once
Oh,
I
already.
finish this
Oh,
video,
wonderful.
so I'll upload a photo of this session and tag you. And
Absolutely.
I can assure
Let
you we'll
wisdom
easily get
spread.
close to 150 feedbacks and comments.
Yeah. So
That's
we
a
are also
wonderful.
documenting the feedbacks. Will post you, sir, the feedbacks that we are receiving.
Sure. Thanks, Anshuman.
Hello, sir. Good evening.
Yes, Pratichi, you were waiting since long.
Yes, sir. I am. Sir, I have a question about if lifestyle medications would be able to suppress the genetic disorders
Ah,
passed by.
ah. First of all, let's shake hand that together we want to keep that as one agenda. But the understanding till now, I think genetics, genetics today also has a term epigenetics. What does the difference means? Genomics is what you get from hereditary, what we have learned in our schools, colleges till now. The latest understandings is genomics are being actively worked on. Our genes are changing almost on a daily basis. And if they are adverse change for a few days, then at some point it becomes one SNP, single nucleotide polymorphism. And then it stays in our cell, and then it spreads in a cell. And then we tend to acquire a new trait. This is happening. I mean, genetic changes are happening every day. A genetic new manifestations may happen in a few years. Like how in a chronic disease, slowly, silently it happens and then it manifests, as a heart attack. Same phenomena is happening in epigenetics, which can take form of a new trait. So from that point of view, if we adopt now, there are no diagnostics. There is a meta-analysis what we need to use based on all the understanding of genomics. If you pick up one wise thought, what I shared is that is the thought. So we adopt healthy lifestyles. We believe in healthy sleep every day continuously. We don't compromise on that. We don't abuse our bodies with toxic substances. When you're protecting your genes and you're not allowing adverse changes to happen. That is already proven connect between healthy lifestyles and preserving genes, but it's not yet of changing wrong genes to healthy genes is still long time. But I want to keep that as a goal for the very interesting thought what you have brought in, Pratiti.
Okay, sir. Thank you so much, sir. And the session was, of course, very informative, and I hope we would be able to change, to modify our lifestyles in the positive way, in the right way, and of the patients we came across. Thank you, sir.
Wonderful, wonderful. Very happy to hear that from you, Pratiti.
Sir, actually, the participants of this session are from almost every state in India, sir. So all the
Oh,
states where
wow.
family program is
I'm
offered.
talking to a
So
mini India in PSPP.
Pratik is from Gujarat. So Alvin,
Oh,
you can
wonderful.
just quickly maybe share your screen and show the all the comments which we got so far in feedback section.
Wonderful. It will be great.
So Alvin or Vina, anyone can share your screen and just.
And we'll show the like comments we got in the feedback we got in comment section just to scroll. And actually, sir also has prior experience of working with few PharmDs, and sir understands the program very well. We need not even have to introduce what PharmD is, what our problems are.
Absolutely.
These are all the key
Wonderful,
aspects.
wonderful.
Hello, sir. Good evening, sir.
Yes,
I
sir.
want to share my feedback, sir. Really, I was waiting for your session. I was now really glad that information was very effective because most of us are surrounded by people who are having chronic problems. Now,
Yes.
the spectrum of care what you have mentioned really gave me a clarity of what exactly the situation is, and really the information in your slides was. I came to know some of the resources from where the information can be collected. Thank you for the information, sir. Thank you so much.
Wonderful. Very happy to know that people are getting benefit. Well, thanks for the wonderful comments, PSPP members and enthusiasts. I really feel so happy from within. Wonderful. I would only share that I am available. We can create programs. I am very happy to enable if it helps. And also, I would like to hear from most of you because, as Karthik was telling, I'm looking at programs what can be, aligned with the chronic disease programs, be it government, be it corporates, be it hospitals. So many of you would be working in hospitals. Very happy to actually work with medical teams in the hospitals and enable in whatever capacities I have. So I'll be delighted to actually
Sure,
serve.
sir. We're extremely happy to like be part of that program, learn, and then implement in practice. So thank you so much, sir. And feedbacks you can see all the time.
Wonderful. I think I'll keep them with me. I'll keep reading almost on a daily basis.
Yeah,
But
we'll
yeah,
share
I
all of
think
them, sir. Compile, put in some doc or something and share. And anyways, you can find all this on the YouTube video which we have uploaded also, sir.
perfect. For time being a constraint, we should close the discussion. And I want to genuinely thank all of you for participating and making this session a wonderful experience for me.
Thank you, sir. Bye and take care, sir.
Bye. Have a nice day. Thanks, Karthik. Thanks
Thank you,
all.
sir.
Thank you, 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 sir.
So, Alvin, you can end the live stream.